All right. How's everybody doing? Good day, Source Nation. How's everybody doing? This is Dr. Samori Swygert. I want to welcome you to SRN Live Television. I'm Dr. Samori Swygert, your host of the Pendulum. And today we're going to have a very important show. We're going to have a very, very important show. But before I go any further, I just want to make sure that we thank our sponsors because they make all this possible. And so let's go ahead and get to this gratitude of thanks. That goes to Zuliana Health and Fitness, Paper to Film Productions, Renovations, New Covenant of Praise Worship Center, Meet My Types Matchmaking, Blend to Blend Juice Bar Boutique, and Urban Grandstand Digital. Now, Source Nation, if you would like to advertise with SRN Live Television, make sure you contact Kathy B at kathylyn1971@gmail.com. That's KATHYLYNN 1971@gmail.com or TreacieJeffcoat@gmail.com. That's TRECIEJEFFCOAT@gmail.com. Now, make sure you share this with your friends on Twitter, Facebook, Instagram, all your different social media platforms, and let's get into it. So, what we're talking about today on the Pendulum with me is I ran across a very, very interesting article. It's a very sad article, but it had to be, we had to talk about it. The reason that we have to talk about it is because far too many of us are falling victim to drugs. So, this past weekend, I was reading an article on WTOP's website. So that's like a website for local news in the DMV, DC, Maryland, Virginia area. And they were talking about how there's been this epidemic rise in the use of these synthetic drugs. And specifically, they were talking about what's called K2 or spice. You've seen a lot of these new synthesized drugs, K2, spice, bath salts, crocodile, what's this, flocka. So these things are popping up on the map. They're popping up in communities, urban neighborhoods, to even the suburban residentials, and even rural areas. Now, I spoke about this before. I spoke about it last year as a warning, and now these things are actually coming to pass right now. And so what I read in the article with WTOP, it was saying that, let me pull it right here, I have it for you. Check this, if you have time, the article, this is the title, okay? It says, a bad batch of K2 in DC, meaning District of Columbia, leads to hundreds of overdoses in 1 week. Now, it says hundreds of people have been overdosing in the district over the past week due to K2, a dangerous street drug that's often misleadingly called synthetic cannabis, meaning fake weed. There were a staggering 244 overdose cases from Monday, September 10th through Sunday, September 16th, according to DC Fire Department. More than 80 cases were reported on Friday alone. All right, that's serious business. 244 overdose cases on this stuff. 80 cases alone on Friday. And see, what's happening is they're getting this, they're getting fake marijuana. They get whatever type of herb that looks like marijuana, whatever the case may be, and they're spraying it with chemicals. Nobody knows what these chemicals are. Nobody knows what these ingredients are. Nobody knows what these chemical molecular structures are and what adverse impact and adverse reactions they're having on the people's bodies and their physiological systems when they take this stuff, when they smoke this stuff, when they ingest this stuff, right? Nobody knows where it really comes from. They haven't been able to track this type of stuff. So it's imperative and important that as family members, churchgoers, mentors, whatever role you play, when you have young people, teenagers, even kids. I saw a video of, I think it was a 12-year-old high on K2, and he was rolling around, hallucinating, spazzing out on the ground, like having like rigors, like his body was all contorted in like all these different crazy physical positions that is just unnatural, you know. Couldn't even talk. He was grunting and moaning, and it looked like it was a possessed animal, a demon, or something, some of that sort. And so we're looking at these things inundate and infiltrate and insert themselves in our societies and in our communities and our families. And this stuff is dangerous. Like I said, nobody fully knows where the stuff is coming from, and nobody knows fully what the impact is. I tell people this all the time. Like, look, the same way that people, like, you know, in some societies, even here in America, like if a person commits rape, in some societies, depending on where you are in the world, they may kill you for committing a rape, they may castrate you for committing a rape, and they may chemically castrate you, meaning I can give you a chemical that will stop you from being able to reproduce and achieve libido to even get an erection to engage in sexual intercourse, right? Permanently from now, the day you receive this drug to the day that you die, you will not be able to breathe, period, right? Same way you think of, there are some, you think of birth control, you know, there are shots that women can take that stop them from conceiving for, you know, an extended period of time until they're ready to resume the desire to conceive as a mother. Why am I saying that? That's because there are chemicals out here that have devastating effects and impacts on the human body that many of us don't know about. If we have these type of things that can sterilize you and stop you from conceiving permanently, who knows what's in these in these drugs, these street drugs that these kids are smoking? You don't know that. You don't know what's inside these drugs. And they're just smoking them. They don't know where they're getting it from. It's not like it's coming from a well-regulated, authorized distribution like you would expect with the drug companies regulated by the FDA. You know, no, this stuff is illicit drugs, street corner drugs that people are just selling and putting anything on it because they think it's going to let people get high. And so these psychotropics and these neurostimulants are causing young people to lose their minds. They're dying, right? Now, with that being said, let's bring up some things, because it's not just K2. I want to run the whole gamut. You have K2, you have spice, you have crocodile, you have bath salts, you have flocka. But then you also have benzodiazepines. This is where you hear people say, yeah, you know, I was popping Xanax or Xannies. That's a nickname for Xanax. Xanax is chemically called alprazolam. It's a benzodiazepine. They use that to calm people down that may have anxiety. Xanax is a actual pharmaceutical drug produced by a drug manufacturer in the United States Pharmacopoeia, right? But that is a controlled substance, right? It is a controlled substance, meaning that it is to be regulated. It is governed by the government. It has a potential addiction, as a potential for addiction. It should be monitored and regulated carefully. And prescribers must have the correct and proper credentials that authorizes them to prescribe these medications, right? Now, you have some people that are just popping these things for recreation and for enjoyment and pleasure. This is why you hear rappers talking about, oh yeah, you know, yeah, I was popping them Xannies, pull off the panties with the grannies, popping zannies with the nannies and all that nonsense. And it's like, yo, you don't know what you're doing. You don't know what you're doing, and you're spreading this drug culture that's going to end up creating addiction in our neighborhood. It's going to cause people to die in overdoses, cause this dependency, and just a whole whirlwind of problems that people are not looking at, but we're just thinking about in pleasure, excitement, and enjoyment, right? So we look at that. The other thing you may hear people say, yeah, you know, ecstasy and Molly. So all these psychotropic stimulants are just circulating around, you know, and people are popping them like candy. So let's talk about some things real quick to make sure that people get this. We can talk about to make sure that we hit home about how serious it is. Because see, one thing, when it happens on the regular basis to the average Joe Schmo that nobody knows, it kind of goes under the rug. But when people of some notoriety or celebrity or some type of status, when they overdose or when they overdose and die, then people start taking a little bit more serious. So let's not forget that the actor Philip Seymour Hoffman, he died of a heroin overdose. Let's not forget that our beloved singer, performer, entertainer, the great Prince Nelson Rogers, he died and was found to have high amounts of I don't know if it was OxyContin or fentanyl in his system. Gucci Mane, the rapper, who admitted that he was having a problem with lean, you know, sipping lean. This is where they mix like codeine and promethazine inside their soda or inside their juice, and they drink that on ice. They call that lean. So he was like, you know, he was addicted to that. But when he got locked up, of course, you know, you don't have access and availability to mix these concoctions. And so it was like a enforced detox on him. But he was like, he was glad that that was out of his system and he doesn't do it anymore. Lil Bow Wow talked about how he had a problem with lean and had addiction and he had to break it. Lil Wayne was very big on drinking lean and, abusing lean. Once again, that's the codeine and the promethazine mixed in with the soda and the juice. And remember, some of the things, these things have side effects that affect you neurologically. Lil Wayne and Rick Ross, and both of these gentlemen end up succumbing to seizures. You know, and seizures are they're nothing to play with. These seizures will cause you to spaz out of your mind. Your muscles tense up. Your body has no control of itself. If uncontrolled and if not intervened medically in an appropriate amount of time, you can suffer a anoxic brain injury where your brain doesn't get enough oxygen and you die. This stuff is nothing to play with. You have a seizure, you fall out, and you can hit your head on the floor and die, have a concussion. They call get a subarachnoid hemorrhage, a subdural hematoma in your brain. Okay, this stuff is serious. I deal with this stuff. I see this stuff every day at work. Let's not forget about the rapper Pimp C from Texas, part of UGK, one of my favorite rap groups. It is alleged that, he was, his death was somehow correlated with the use or overdose of lean, right? Let's not forget about Heath Ledger, the actor who played the Joker. The rapper Lil Peep, he died of an overdose earlier this year, 2018. We just had the death of rapper Mac Miller, overdose death. That was about a week ago. Rest in peace to these gentlemen. We had the Demi Lovato. She had an overdose, drug overdose. So, this drug culture, it's one of those things where it's like, it may be enjoyment for some, you can get to go on a mind trip, or you may feel very relaxed or very elated or very restful, or just whatever the case may be. Sometimes it's not worth it. It's really not worth it. Excuse me. And there's no guarantee that you'll come back from that. There's no guarantee. Some people have smoked crack or cocaine and have died with a heart attack for the very first. Lynn Bias, the basketball player for University of Maryland. He was supposed to be the LeBron James before LeBron James. This was in the 80s. It was in the 80s or very early 90s, maybe 91, but it was like either late 80s or like maybe like 91. This is around the time when the Georgetown Hoyas was they were doing real good. He had tried cocaine or crack. I'm not sure which form it was, but he had a heart attack and died very first hit. So it's important and it's imperative that we tell y'all to do not engage in these things. Tell your children do not engage in them. Explain to them the severity and the seriousness of it and the dangers of it. You have to have this conversation not just with your children, but if they have friends and their friends come by the house, look, we all going to have this conversation because I won't have you influencing my child, right? And at the same time, if you're my child's friend, I love you too. So I have care and concern and feelings for you. I want the best. I want you to be a healthy, productive citizen. So yes, I have to intervene as an elder, okay? So that's what made me want to go ahead and bring this up. They also go on to underscore in the article, they said since mid-July, there have been, since mid-July 2018, in D.C., there have been about 1,200 overdose cases tied to K2 since mid-July of 2018. Over 1,200 overdoses of K2 in DC alone. So this stuff is serious, right? Where's my next piece of data that I want to get into with you? Now we asked, how did this stuff start? So, it's interesting because, we had the anybody that was definitely around in the 80s and the 90s, we had a very big crack problem that went throughout the country, and this is where you had the, so you had a lot of the drug cartels come from Colombia, Nicaragua. You had a lot of drug cartels that were flooding the U.S. With these drugs, and they were hitting up. So they were able to find individuals in various cities across the nation that were able to devise very intricate drug distribution networks and had a broad range, a wide clientele customer base. And they caused a whole, almost 2 generations to be addicted to crack. And this was happening all up and down the Eastern Seaboard, Connecticut, New York, New Jersey, Philly, Virginia, North Carolina, Atlanta. You had it out there in Chicago, Detroit, Ohio, California, all of that. Like it was very it was widespread, and it was a very big problem. If you're young and you're not sure, I'm telling you, this is serious business. And so then you had the war on drugs, but then the war on drugs, it turned out to be really one of the things where they were targeting Black community. And you've seen not just scores of people overdosing on a regular basis and dying, but you saw scores of Black and Latinos being targeted and arrested for drug use. Yes, you had drug dealers, but people were getting locked up for drug use. And so you're seeing entire families and communities being dismantled systematically. But then what came out was that you had the Nicaragua, why am I getting the name wrong? But it was the Contra affair with the Nicaraguans. The Iran-Contra scandal, that's what it was, with Oliver North. And how it was, they were trying to get weapons and all this going on with Iran and getting the money They didn't want to trace the money or how they were buying weapons, so they were using drugs as the means for a lot of this stuff. And so they were helping funnel all these drugs into the United States that were getting us hooked. And so this is where you have the whole story with Freeway, Ricky Ross, and just a wide access to these drugs and narcotics. Now, that's in the 80s and 90s. Now, from the 70s and the 60s, cocaine and heroin were the big things. And so many people were hooked on heroin. A lot of the, if you're like in your 70s, I'll say if you're late 60s to 80s right now, you may know of cousins and uncles and brothers that went away to Vietnam and the Korean War that got hooked on heroin. Started out to treat pain, whether they were, they may have been injured in the war overseas. A lot of those soldiers came back addicted to heroin, using, opioid narcotics. When you say opioids, that is opioids. The term opioid is a actual authorized name for opium-derived drugs that are regulated by the federal government. So they are actually derived from opium, approved for medicinal use in a controlled setting and under the approval of a licensed healthcare practitioner to use. Those are hydromorphone, morphine, codeine, oxycodone, all right, hydrocodone. And so from all that, you get different brand names and stuff, Percocet, Vicodin, Lortab, all these different things. Then what they did was they, scientifically, as modern medicine always progresses, you have your lab technicians and you have drug companies and researchers that are always doing their research and development, trying to find new ways in which they can improve drug delivery, target receptors in the body a little bit more accurately. They can improve how long the drug stays in the system and works specifically on pain receptors. If they can come up with topical applications of it, if before it was only available oral, that they can come up with an IV route. If it was only an IV route, they come out with the oral solution for it. So, you had all that. So then came what's called fentanyl. Fentanyl is a synthetic derivative of the opioids. So you had opium first, then they synthesized the opioids, the hydromorphone, the morphine, the codeine, all of that. And then from there, they synthesized fentanyl. Now, fentanyl is no joke. It's the most powerful of all of them. It's the most powerful of all of them. It's more potent than hydromorphone. It's more potent than morphine. It's more potent than codeine. All right? It's more powerful than opium. And see, the dangers with all of these medications and the benzodiazepines like Xanax is that what happens is they suppress your respiratory drive. You have receptors in your brain. And so it works on these receptors to relieve the pain, but at the same time, it decreases your drive or your ability to breathe appropriately by yourself. Like, if I was to tell you to hold your breath, eventually your body's going to force you to breathe. It's going to force you to exhale and inhale. Well, it shuts down that natural breathing pattern and breathing cycle inside the body at high doses. And so people are, they're taking this stuff in addition to alcohol, which also has a very similar effect. And this is why you start to see so many people overdose. When they say you see people nodding off, that's because aside from the relief from the pain, they're not getting enough oxygen to the brain. They're getting slowed down. They're nodding out and fading out. This is why they get sleepy and drowsy. All right? And so when given in the high doses, overdose, your whole breathing shuts down. And what happens is they basically suffocate. They suffocate. And that's what's happening to your kids out here in the streets. They're playing with these things. This is what happened with the rappers. They're playing with these things, not knowing the real impact it's having, and they're dying just from that. So, talking about this now, they call it an opioid crisis, and now they want to give a lot of treatment instead of incarceration. During the 80s and 90s, they were incarcerating everybody, but now they want to treat, they want to provide treatment, and that's okay. We want to make sure that everybody does stay alive, but at the same time, it's a very big smack in the face to a lot of black and brown people that pretty much succumb to the same addiction, but they're serving prison sentences. Whereas, now you're not going to do any time. We're just going to get you in a therapy and rehabilitation program and let you get back on your feet. So there needs to be some type of retroactive redress for, what has happened in the past. Now, what I'm going to talk about right here is from the NIH, the National Institutes of Health. They have something on the opioid overdose crisis, and I like what they did. They have a section called "How Did This Happen?" And it said this: in the late 1990s. Now listen to this. See, because we have to make sure we hold all parties responsible that are culpable in this current opioid crisis. We have to hold them responsible. And these aren't necessarily street dealers on the corner. These are bigger ups from drug manufacturing companies and doctors' offices and healthcare practitioners and prescribers. It said, in the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to prescription opioid pain relievers, and healthcare providers began to prescribe them at greater rates because they felt that, look, they told them that they're not going to become addicted. They weren't going to get hooked. So they felt that this was safe and efficacious. This subsequently led to widespread diversion and misuse of these medications before it became clear that these medications could indeed be highly addictive. Okay? Listen to this. And I want you to pay attention to the dates and the numbers. In 2015, more than 33,000 Americans died as a result of opioid overdose, including prescription opioids, heroin, and illicitly manufactured fentanyl, a powerful synthetic opioid. All right. That same year, an estimated 2 million people in the United States suffered from substance use disorders, meaning addiction. It's a substance use disorder. Technical word and technical jargon of saying addiction. And 591,000 suffered from a heroin use disorder, right? Now, let's look at some of, I want to go to a different article to come back. I want to go to, this is from the CDC. Okay. I'm going to go here because if you pay attention to the dates, you're going to see how extreme this drug use has grown. So, in the NIH article, I said in 2015, there were more than 33,000 Americans that died as a result of opioid overdose. Say it with me. 2015, 33,000 died from opioid overdose. Okay, so the next year, 2016, 63,632 Americans died from opioid overdose. All right. So remember, 2015, only 33,000 Americans died from opioid overdose. The very next year, 63,632 Americans died. That means it doubled. It doubled in 1 year. In 1 year, the amount of opioid deaths has doubled. That is crazy, right? And so now the most recent data that we have is in 2017, the drug overdoses have surpassed 72,000. So check that out. In 2015, 33,000 Americans died. In 2016, it doubled to 63,000 Americans that died. And in 2017, over 72,000 Americans have died in opioid overdoses. These are serious jaw-dropping numbers right there. Serious numbers. Serious numbers. Like, it's not a game. If I was to tell you that 50,000 people died, that's like saying, oh, that's 1,000 people in each state that just died from, like, that's a lot. It is a lot. And I don't think people are taking this seriously. People don't understand this is serious business. So for that 2017 statistic that said over 72,000 have died from opioid overdose, they said if you were to tease it out to make it a more understandable number, that's saying about 200 overdose deaths occur every single day or every 8 minutes. So every 8 minutes, somebody's dying from an opioid overdose. All right. Now, what did they say too? So the fentanyl, the one I said that's more potent than all of them, in 2017, 30,000 of the 72,000 that have died, 30,000 of them all died from fentanyl overdoses, right? Now, here's the thing. I'm going to read to you. I have it highlighted so that y'all know. See the highlight section. This is how you know the severity of it. You think people were overdosing of heroin in the 70s? That's heroin. This one said that's heroin. We talking about fentanyl now. They say a chief concern among substance abuse experts is the ubiquity of fentanyl, meaning widespread availability. A synthetic opioid that's roughly 50 times more potent than heroin because it's cheap and relatively easy to make, and is oftentimes mixed inside of heroin and cocaine. So people are getting hot doses thinking they're getting regular heroin or thinking they're getting cocaine, and they're getting fentanyl mixed in. But I just told you, based on what they said, fentanyl is 50 times more potent than heroin. 50 times more potent than heroin. And so you have people there. There's been cases where people are putting fentanyl inside marijuana because, you know, people want to see if they got a good product. Like, oh yeah, I got the best marijuana. It's like, no, you're lacing it with fentanyl, and you're so dumb. You're killing people. They thinking they're smoking marijuana and they smoking fentanyl and dying. 50 times more potent than heroin. And so, you know, they say you had policymakers that have struggled to come up with an adequate response to the opioid crisis. A lot of this stuff ballooned under the Obama administration time period, true. But they said, so Trump has been the one to really declare it a public health crisis. But here's the thing. They said that a lot of Congress and former Congressman Patrick Kennedy of Rhode Island, a member of the task force that the administration convened to tackle the epidemic, criticized President Trump late last year for being all talk and no follow through on opioids, because a lot of the states were not getting any federal funding for these programs that are supposed to be used to combat the spread of opioids. So that's one of the big problems right there. I want to go back to, here we go, demographics. Now, let's get into the geographic distributions, the demographics, the epidemiology, right? So, where are we seeing these? Where are we seeing them? This is occurring. It says geographically, the deaths are distributed similarly to how they've been in prior years, with parts of Appalachia and New England showing the highest mortality rates. Once again, the highest rates were seen in West Virginia, with 58.7 overdose deaths for every 100,000 residents. The District of Columbia, with 50.4 overdose deaths for every 100,000 residents. Pennsylvania, 44.1 overdose deaths for every 100,000 residents. Ohio, 44 overdose deaths per 100,000 residents. And Maryland, 37.9 deaths for every 100,000 residents. They rounded up the top 5, right? Now, they said at the other end of the spectrum, states in the Great Plains had some of the lowest death rates. Nebraska had the fewest, with just 8.2 deaths per 100,000. What else did they say here? Now, let's go over here, because there was some other data that I want to look at. Here we go. This is following back up on the CDC. Here we go. Death rates from overdoses involving synthetic opioids increased in 21 states, with 10 states doubling their rates from 2015 to 2016. New Hampshire, West Virginia, Massachusetts had the highest death rates from synthetic opioids. 14 states had significant increases in death rates involving heroin, with Washington, D.C., West Virginia, and Ohio having the highest rates. Excuse me. 8 states had significant increases in death rates involving prescription opioids. West Virginia, Maryland, Maine, and Utah had the highest rates. 16 states had significant increases in death rates involving cocaine, with Washington, D.C., Rhode Island, and Ohio having the highest rates. 14 states had significant increases in death rates involving psychostimulants. That's the bath salts, the Molly, the ecstasy, your methamphetamines, your K2, your spice, your bath salts, your flocka, your crocodile, all of that. 14 states had significant increases in those death rates. The highest death rates occurred primarily in the Midwest and Western region. All right. And so they're saying that effective synchronized programs to prevent drug overdoses will require coordination of law enforcement, first responders, mental health, substance abuse providers, public health agencies, and community partners. Right? And so it's a big thing to the point now where they have made the antidote for overdose of the opioids. Not the flocka, not the K2, not the spice, not the ecstasy, not the methamphetamines, not the flocka, but just for the opioids. They had to make the reversal agent or the antidote so widely available so that ambulances have to have them at all times. Many police officers and fire EMS workers must carry this reversal agent. The reversal agent must be readily accessible and purchasable in your Rite Aid, your Walgreens, your CVS, your Eckerts, all your traditional chain pharmacies have to have that readily available in case somebody decides to overdose. Clinics are having these. And so that drug is called naloxone or Narcan, 0.4 milligrams a shot. And what that does is when it gets inside the body, like let's say my hand is a drug receptor. What happens is when they take cocaine or morphine or oxycodone, and all that. If this is a drug, it sits right there on the receptor, and then it activates the receptor and it triggers that response that everybody feels, the euphoria and the pain release and all of that. So what happens is, if this is like morphine and this is the receptor, the drug comes along, the antidote comes along and knocks the morphine off. It knocks the codeine off of the receptor, so you're no longer getting that high and you're no longer getting the physiological effects. So that's what the antidote does. It knocks the drug off the receptor, and thus it cuts and inhibits the reaction that the person experiences, that the user experiences. All right. So that's what we see there. Now, where do I want to go with that from here? Oh, okay. So we're saying that it's a crisis. It's a public health crisis. Yes. It's a crisis also because one, a lot of people are shooting up heroin, and you'd be amazed at the different ways in which people on the street manipulate drugs. You know, some people will chew drugs, they'll put it underneath their tongue, they'll snort it, they'll shoot it. So you have different ways in which people administer the drug to themselves. So this is where you get the contamination, the spread of HIV and hepatitis C. That's an issue. Addiction in itself, that is an economic issue because people are constantly shelling out when they're addicted. So you're going to see the shelling out of money. People going broke, trying to fuel an addiction, having a financial impact on their family members, constantly borrowing money, pawning things, stealing things, to the point that, look, this is, you're eating into other people's budgets, you know, while on these medications, while on these drugs, these illicit drugs, committing crimes to get these drugs and getting arrested. And then people have to bail you out. You understand what I'm saying? So now people are putting up houses, putting up large sums of money. So you have that. You have, in a lot of public housing, you cannot be a felon. You can't be a felon. In many public housing developments, you cannot be a felon. You cannot use illicit drugs. They find out, you will be immediately evicted. So now you're talking about spouses that are addicted, children that are addicted, that may cause a whole family to be uprooted from their home, their domestic situation. So it's a very serious thing. And this is just aside from the overdoses. It's also a burden on the healthcare system because they're like when a person comes in to the emergency room, you have people that are there for all types of things. You have people that may have pneumonia, some people may have the flu, some people may have gastrointestinal issues, some people may be coming in from a heart attack, some people may be having a stroke, some people may have high blood pressure, diabetes, complications, they may have lung complications, respiratory issues, and so they're in the hospital for like legitimate reasons. But as the ER personnel are taking care and triaging care for these patients, you've got an ocean of people coming in at the same time overdosing. Do you have enough nurses, doctors, physician assistants, respiratory therapists, pharmacists, RNs? Do you have enough staff and personnel that are trained and equipped to deal with? Look, we've got, like I just gave you the numbers to the K2 overdoses, where they said it was 244 patients in a week. So, you know, on a Friday night when everybody's out partying and having a good time, aside from everything that's happening in the ER, women, family coming in, giving birth, you know, the mother's coming into ER, she's going in labor. Somebody's grandfather's coming into the ER because he's having a heart attack. Somebody's son is coming in because they're having a seizure or something. And I got 20 people outside of my ER about to come in because they're overdosing. How many doctors, how many extra doctors does a hospital now have to budget to make sure that they have enough You can't deny treatment, okay? How many doctors, how many physician assistants, how many nurses and nurse practitioners and pharmacists do we have to treat this person? How much money do we have in the budget to buy these antidotes and the reversal agents for these overdoses? And they're gonna have to. It's going to take time. They're gonna have to, work the patient up. They're gonna have to spend time in ER, give them the medication, give them hydration, and everything else that comes with that. They're going to do a tox screen to find out if they're actually, what are they actually treating? We have to draw blood work to see, is this the actual opioid overdose, or is this something else? Like, is this K2 overdose? Is it something else? So this is what we're saying. Like, it drains the budget, because you have to make sure you have adequate supply of reversal drugs to treat the overdose. You have to have the right amount of staff to treat, to tend to the patients. And we may even have to expand the facility, the infrastructure of the ER. Because you may have maybe 20 beds in the ER, or whatever the case may be, depending on the size of your hospital. We now might have to expand just because of that. Do we have enough of that in the budget? So this is what I'm saying, where it is a burden on the healthcare budget. It's a burden on the family. It's a burden on even the judicial system. Like I said, some people are getting locked up. They try not to, but it is what it is. And then the burden of disease transmission, like I said, with the hepatitis C and HIV. So these are some serious things that I don't think people are really taking into consideration, full consideration, and the severity of what we're seeing right here. So now a lot of people want to know, well, what is the NIH, CDC, and Department of Health and Human Services, what are they actually doing to somehow prevent this or eradicate this? So they have a couple of things. I'll read to you what they have. This is from, this one is from the NIH. It says, in response to the opioid crisis, the U.S. Department of Health and Human Services is focusing its efforts on 5 major priorities. Number 1, improving access to treatment and recovery services. That's 1. Number 2, promoting use of overdose reversing drugs. That's the naloxone that I was telling you about. Number 3, strengthening our understanding of the epidemic through better public health surveillance. Number 4, providing support for cutting-edge research on pain and addiction. And number 5, advancing better practices for pain management. And so with that, number 5 is very important, advancing better practices for pain management. Because what did I say earlier? They said that the cause was in the late 1990s, pharmaceutical companies reassured the medical community that patients would not become addicted to these prescribed opioids. So now they're saying, look, we have to reevaluate what our standards of practice were. We have to reevaluate that and devise a better plan. So maybe just because this patient is in pain in the hospital, they don't need oxycodone. They may not need morphine. They may not need fentanyl. Or maybe they may not need as much. Or maybe they may not need as much for so long. Maybe a dose or 2. Maybe 2 days worth, and increase something that will relieve pain but won't get them addicted. Increase their dose of Tylenol. Increase ibuprofen use. Use lidocaine patches to apply to surgical sites. There are other neuropathic drugs such as gabapentin and pregabalin that they may use. So a wide range of alternative therapies that either do not use opioids or or are enlisted in a lower dosage and a shorter duration of therapy. And so, let me read this too. The National Institutes of Health, a component of the Health and Human Services, is the nation's leading medical research agency, helping solve the opioid crisis via discovering new and better ways to prevent opioid misuse, treat opioid use disorders, addiction, and manage pain. In the summer of 2017, the National Institutes of Health met with pharmaceutical companies and academic research centers to discuss safe, effective, and non-addictive strategies to manage chronic pain, to develop new and innovative medications and technologies to treat opioid use disorders, and improve overdose prevention and reversal interventions to save lives and support recovery. And so that's big, because the more that they prescribed all those drugs, those opioids in the 90s when it was unnecessary, you have wide access and availability to these. You just have grandma went to the hospital, they discharged her with 30 tablets of Percocet, and she doesn't use them anymore, but you probably have 15 Percocets still there, and grandson comes over and he's heard about it, and he's dabbling or she's dabbling in their parents and grandparents' medication, taking this stuff. And this is how some of it happens. You meddling around in the medication cabinet is where addiction can start, right in the home. It doesn't have to occur on the corner. It can happen right inside your bathroom cabinet. All right. So it's important for us, even as adults, you take these medications, probably one of those, the same way we talk about gun control and locking up your guns, you probably need to lock up your medications from your children, because some of them are doing it. They're overdosing on some of these medications inside the cabinet. Lastly, it was in April 2018 at the National Prescription Drug Abuse and Heroin Summit, the NIH director, Francis S. Collins, MD, PhD, announced the launch of the HEAL Initiative, HEAL, the HEAL Initiative, and that stands for Helping to End Addiction Long-Term Initiative. And it's described as an aggressive trans-agency effort to speed scientific solutions to stem national opioid public health crisis. So, these are the things that are occurring in our community. It is very important that we have these discussions with our friends, our family, our children. Let them know of the importance of staying away from these things and not using them, not hanging with the people that they know are using them, and look at all of the casualties. Like I said, the Philip Seymour Hoffman, the Prince, Gucci Mane, Lil Bow Wow, Lil Wayne, Rick Ross, Pimp C, Heath Ledger, Lil Peep, Mac Miller, Demi Lovato. I mean, the list goes on and on and on. But, to not take this stuff lightly. You put on this earth for a reason, and it wasn't to kill yourself. So, and just to have them find more positive and healthier, safe, alternative means of enjoyment and fulfillment and satisfaction. It doesn't necessarily have to become chemical, So these are the things that I think are important. I had to have that conversation because when I saw that article about the 244 K2 overdoses in D.C. from last week, it really struck a nerve with me, and I just felt like we had to talk about that here on the Pendulum. So with that being said, I'm getting ready to sign out. Once again, this is Dr. Samori Swygert on SRN Live Television on my show, The Pendulum. Every Wednesday, we have thought-provoking discussions. Sometimes I have guests, and then sometimes I'm riding solo in the saddle like I am today. I'm riding driver and shotgun all in one. So with that said, I want to take my time to thank our sponsors one more time, and they are Zuliana Health and Fitness, Paper to Film Productions, Renovations, New Covenant of Praise Worship Center, Meet My Types Matchmaking, Blend to Blend Juice Bar Boutique, and Urban Grandstand Digital. And once again, Source Nation, if you'd like to advertise with SRN Live Television, make sure that you contact Kathy B at kathylynn1971@gmail.com. That is KATHYLYNN 1971@gmail.com, or Tracy Jeffcoat at gmail.com. That is TRECIEJEFFCOAT@gmail.com. You can find me on Twitter at DocSwag06. That's DOCSWAGG06 on Twitter. You can also find me on YouTube, and we're under the SRN Live Television, and on Facebook, SRN Live Television. So you want to check that out. And we have a wide array and assortment of great hosts that talk about everything from physical fitness to nutrition and dietary needs, to politics, to finance, to music, to dating and relationships and spirituality. So you in sports. So make sure that you always stay locked in to SRN Live Television. We have a great lineup that will always keep you entertained every day. And we're constantly posting new videos, new blogs, new vlogs, and new podcasts. So make sure you check us out. All right? Peace.
Get at me for beats, yo.